Well, good morning, students in Regina, Saskatoon, the Battleford, Swift Current, Moose Jaw, Canoe, Narrows, and everywhere that people are tuning in today. I'm Peter Mills, and I will be hosting our CBC COVID-19 Q&A with kids like you. And also thank you to everybody who's joining us on cbc.ca/sask and also the CBC Gem app and also the CBC Saskatchewan YouTube channel. So I'm really excited for this conversation because, guys, I've done a lot of interviews in the past year and a half about the pandemic, about COVID-19. I've talked to Saskatchewan Rough Riders, I've talked to musicians and politicians and business owners, but I haven't had a chance to talk with many kids like you because we've been separated. And you guys bring such an interesting, very important perspective, and we look forward to hearing your questions today and just hearing a little bit about how COVID-19 has affected your lives. So you're all going to get a chance to ask some questions, and we're really excited for that. And also, I'm very excited for our guest today because even though I've talked a lot about COVID-19 in the past year and a half, I don't know nearly as much as our expert, and that would be Dr. Joseph Blondeau, who is the head of microbiology at the Royal University Hospital in Saskatoon. And he also teaches about infectious disease at the University of Saskatchewan. I have talked to him several times. He always has great answers for my questions, and I know he's going to have the same for you. So again, don't be nervous, nothing to be afraid of, nothing's a bad question. We're all in this together, and we're all going to learn more. And also, we have a series of really great and informative videos from CBC Kids News hosted by Sarah Chaudry. So we'll be seeing some of those throughout the program today. So again, if you're tuning in on YouTube, you will be able to leave your questions in the comments section there, and our producer Alex will pass them on to me. So again, don't be afraid to add some comments to the YouTube page as well. And then also you can reach me directly on Twitter. I'm at TweeterMillsCBC. So before we get to the questions, we're going to hop right into it right away, but I just want to check in with Dr. Blondeau. Dr. Blondeau, you've been talking about COVID-19 and the pandemic for many months now. Just how are you doing today?
Oh, Peter, thanks very much for asking me to come and do this. I'm really excited for this interaction this morning, and I'm thrilled that these school children from across the province are going to put some questions out there, and hopefully I can answer them. Yeah, no, I'm doing good. You know, we continue to be very, very busy within the hospitals and within the labs in the province, testing patients that we suspect have COVID. We continue to be very, very busy trying to communicate, important information out to people about the pandemic and what they should and should not be doing. And like everybody else, we're all interested in seeing this come to an end at some point in time. So let's get started with the questions and see whether or not the kids are going to stump me today.
Well, let's find out indeed. All right, let's start with Sarah Campbell, who I believe is in grade 5 at Arcola School in Regina. Hey, Sarah, are you there?
Yes. Doctor, can we achieve herd immunity without kids under the age of 12 being vaccinated?
Wow, what a great question. In my opinion, it really depends on what the percentage of children under 12 are in the population. So let's just put this into a numerical value. Let's just say that we have 1 million people in the population, and let's say that 200,000 of those are under 12 years of age. So that would mean that you would have 80% of the population that would be immunized if everybody over 12 were vaccinated. So the answer for me, for your question is, I think having children vaccinated is an important step towards achieving herd immunity for the whole population. So I think children are an important part of that as well. So I don't think we can get to herd immunity without having children vaccinated as well.
And thank you, Sarah, very much for joining us today and asking that question. A very good question right off the top. Okay, let's move along to Annabelle Buchwald in grade 6 in the iGen program in Saskatoon. Hi, Annabelle. You there? Give me a wave.
Hi.
What's your question, Annabelle?
I was wondering, what is the most at-risk age group right now since so many vaccines have been given to older people?
Again, what an excellent question. So if I go back a couple of steps, when the pandemic started, the most vulnerable age groups were those that were over 65 years of age, and if they had underlying medical conditions, like let's say they had heart disease or diabetes or some other conditions. But as the older population became immunized, and with the variants of concern making their way into the population, that age group shifted. So now the most vulnerable population are those that are, say, between 30 and 60 years of age, and actually, I guess even a little bit younger, 20 to 60 years of age. As you might know, Annabelle, children are a little less susceptible to serious infections with COVID-19, but they do occur. But we're seeing most of the cases now in that group between, say, 20 and 60 years of age.
Okay, thank you.
You're welcome.
And thank you so much, Annabelle. Let's move along to, let's share a comment from YouTube, first comments. Bria, you get ready. I'll be coming to you next with your question. But first, let's ask a question from the YouTube comments. And Miss Kelly Boyd says, are kids going to be vaccinated? Will there be a wave 4? And when will that be? Just two questions, I guess, two separate questions there. First, Dr. Blondeau, just are kids going to be vaccinated?
Yes, kids are going to be vaccinated. We now know that the vaccine is available for kids that are 16 and over, and that's going to be dropped to 12. And just so everybody understands, there are currently studies that are ongoing with the vaccine manufacturers studying vaccination in children 6 months of age and older. So 6 months up to 11 years of age. Those studies are currently ongoing. And depending on the outcome of those studies will determine whether or not the vaccine can be used safely in those younger populations. But yes, children will be vaccinated, and that has already started it starts as of today, tomorrow within the province, and then the age group will be expanded. The second question was about variants, if I recall.
Yeah, what's the likelihood of another wave?
Yeah, so of another wave really depends on a couple of things. It depends on what percentage of the population gets vaccinated and how quickly that occurs. And then also depends on whether or not the vaccines are effective against the variants. If the vaccines were not effective against the variants, then we would expect another wave. But what the evidence is starting to show, and starting to show quite conclusively, is that the vaccines that are currently available are indeed very active against the variants. And there's some good data out of the United States, out of the United Kingdom, and I think there's some data even starting out of Canada that indicate that to be the case. So if we see a large percentage of the population that remain unvaccinated, that could be the group where we would see another wave. But I think as vaccine numbers go up, that becomes less likely.
Awesome. Thanks, Dr. Blondeau, for that. Okay, let's go to Lakeview School in Regina and grade 6 student Bria Hutchinson. Bria, can you give us a wave if you're there? Hi, Bria.
Thanks for the opportunity to ask a question, Peter and Dr. Blondeau. My class and I would like to know, what are the side effects of the Pfizer vaccine on teens, and should we be worried about getting it?
Well, another great question. So that data is now available, and we know that in the arm that you receive the vaccine, you can expect that your arm will be sore. You may have a little bit of redness, and you may have a little bit of swelling. So those are the common things in the vaccinated arm. Some patients may also experience a day or two, certainly less than 48 hours, where they could be feeling tired. They could be feeling like they have some muscle aches. They could have an upset stomach. They could even have a little bit of a fever and maybe some chills. But if they were to have those symptoms have been shown to resolve in less than 48 hours. So those are the symptoms that have been shown to occur in children who have received the vaccine.
You happy with that, Bria?
Yeah.
Okay, perfect. Well, thanks so much, Bria. Oh, go ahead.
Can we, Peter? Can we ask Bria a question?
Yeah, sure.
Bria, in light of that, Bria, are you feeling confident about getting a vaccine?
Yeah, I'm excited to get it because that's if one person gets a vaccine, that's one less COVID case.
Oh, I love your answer. You're absolutely right. We're all part of the problem, and because of that, we're all part of the solution. That's excellent.
That's right. A great question, Dr. Blondeau, and a great answer, Bria. Thank you so much for taking time, and thank you to all your fellow students at Lakeview School in Regina. Okay, as I mentioned earlier, we have a series of videos from CBC Kids News hosted by Sarah Chaudry. Let's watch one of those videos now before we get to our next question. And this one is looking at the question, do I need to wear a mask around someone who's had the COVID-19 vaccine? Let's take a look at that.
As more people get the coronavirus vaccine, you may be wondering if we still need to wear our masks when we're around other people. Can we get rid of these fashionable yet frustrating accessories? Well, not just yet, say scientists. The study so far, as of January 2021, showed that the vaccine stops people from getting sick. But those studies don't show whether the vaccine stops people from being infectious. That means people who get the vaccine could still catch the virus and give it to others. If you're visiting your grandparents and they have been vaccinated, you still need to wear a mask, the experts say. Because even if they're protected, you could transmit the virus to them and they could spread it to someone else. So until most Canadians have been vaccinated, you should still wear your mask, practice physical distancing, and wash your hands. You'll be protecting the people around you from the virus. Do you have a question you want answered? Send it to us at cbckidsnews@cbc.ca. For CBC Kids News, I'm Sarah Chaudry.
And thank you very much to Sarah for putting those together for us. Really appreciate it today. Okay, let's get some more questions in for Dr. Joseph Blondeau. And let's go to Takunda Musandire, who I believe is at St. Nicholas School in Saskatoon in grade 7. Are you there, Takunda?
Yeah, I'm here.
What's your question, Takunda?
Dr. Blondeau, I was wondering, if you have a vaccine, but you still have the virus, if you still have the virus in your body, can you pass it on to other people who have been infected before but have the vaccine?
Yeah, Dr. Blondeau, were you able to catch that question?
But I think the question was, if you're vaccinated, can you still have the virus and can you still transmit the virus to other people?
Great.
And as we just saw from that video clip, the answer is yes. But the information is actually getting better and much more encouraging. So what the vaccine does, so if you can see my picture here, when you get infected with COVID-19, the virus comes into your nose, it comes into your mouth, etc., and it causes infection there. And in some patients, obviously, it moves into your lungs and causes more severe infection. When you get a vaccine, what the vaccine does is it gives you antibodies that protects you from getting severe infection throughout your body. But it doesn't necessarily give you the protection in your nose and your mouth, which means that once you get vaccinated, you could still be re-exposed to the virus and have a local infection in your nose or your mouth. It's during that period of time when you may transmit the virus to somebody else who is susceptible to virus infection. So earlier there was a question on herd immunity, and as the number of people in the population increase, it decreases the likelihood that we transmit the virus between each other within the population, which is why it's important that so many people, or as many as possible, get vaccinated. Now, where's the good news? There's data coming available indicating that in vaccinated individuals, so if you've received the vaccine, there is between a 40 to 60% reduction in the likelihood of transmission. Why is that number important? Because it's not 100%. And because it's not 100%, it means that we still need to practice all of these important safety measures like wearing a mask and distancing and hand washing until we see that the virus activity in the population is actually diminishing or going away. So a long-winded question, a long-winded answer, but that is the best information we currently have available.
Thumbs up to Kundo. Is that good? We appreciate you joining us today and asking that question. It's a really important question and one that a lot of adults ask all the time when we talk about this on CBC Radio. So thank you so much to Kunda for that. Let's go to Regina's Catholics, or the Regina Catholics Learning Online School, Rebecca Slobodian from grade 7. Hey, Rebecca.
Hi. What are the long-term effects on mental health that this pandemic will have, and what supports does the province need to provide to help those that are struggling?
Well, what a great question. So first of all, I'm not a mental health expert. I'm a clinical microbiologist. However, I have become familiar with some of the literature in this area because it's important to know. What the literature shows is that the COVID has had mental health implications on upwards of about 27% of individuals during this time, meaning that folks have started to suffer some mental health related problems for a number of different reasons. One of the reasons was because we were all confined to either our homes as work environments, or we remained out of contact with individuals within our work environment. We are no longer able to social gather. We can't spend time with our friends or our family members that were outside of our social bubbles. And all of these things had contributed or have contributed to having an impact on the mental health of some individuals within the population. We're doing this presentation today over Skype, but in fact, it would be much better if I was actually able to be in person in front of a classroom and actually interacting with each of you individually. But that's not possible for safety reasons. So I think what has to happen is that we have to see this pandemic start to come to an end to the extent that people are allowed to gather again, that friends are allowed to get together, that we're allowed to have these social interactions. And we need to provide counseling for those patients that need a little extra help in order to get them back on track to what their life was prior to the pandemic to what it's going to be after the pandemic. So I think we have to have resources in this area in order to help people that need that type of help. Great question. Perhaps somebody who's more of an expert in this area would answer it differently, but I think that's what I know in this area.
Thank you.
And thank you, Rebecca.
You're most welcome.
Rebecca, and thank you, Dr. Blondeau, as well. Rebecca, if you don't mind, can I ask you a question? Just how have you been doing during the pandemic?
Well, actually, this pandemic has affected me more positively than I thought it would. Like, I have been doing very well at school, and I am not as deeply negatively affected by this as I thought it would be, because I thought I'd be sad that I couldn't see my friends and I wouldn't be able to go anywhere. But actually, I'm getting used to that.
Yeah.
And it's been pretty good.
That's so good to hear.
So Rebecca, might I say to you, you should take your positive energy and your positive attitude and channel that into helping some of your friends maybe that are having a more difficult time. And maybe you as an individual could be responsible for helping people get over that hump to get them back to where they want to be. And that would be a tremendous accomplishment. So I would encourage you to do so.
Thank you. I will take that information and pass it to my friends.
That's excellent.
Perfect.
Thanks, Dr. Blondeau, and thank you so much, Rebecca. I hope you continue to see the positives. That's great. So great to hear. Dr. Blondeau, I want to ask one more question from our YouTube channel, the CBC Saskatchewan YouTube channel. If you are watching on there, thank you very much for joining us and for putting your comments or your questions into the comments section. We've got this question from Saskatoon Public Schools Holliston grade 6-7 class. Now, Dr. Blondeau, they're asking, when you say vaccines are effective on the variants of concern, what does that actually mean is what the Holliston class is wanting to know.
Okay, so a variant of concern is defined based on a virus which has a mutation. Now, viruses have lots of mutations, but the mutations of concern here are those that are in a part of the virus called the spike protein. And why that's important is because the spike protein is the major part of the virus to which the body develops antibodies. Antibodies are used to fight infection and to prevent you from becoming reinfected. So a variant of concern having this mutation, the big problem is, does the mutation affect enough of the protein that it diminishes the effectiveness of the antibiotic? So in other words, does it make the antibody less able to do its job? And at this point in time, the vaccines that are currently approved in this country are all showing that they're active against the variants of concern that are circulating, meaning that even though there may be a slight reduction in the potency of antibodies against these proteins, it's not sufficient enough to mean that the vaccines don't work. And that's what's important. It's important to know that we track this, we study these variants, and we generate the information that's necessary to show that the vaccines still work. So that is the big issue.
Great. And Dr. Blondeau, speaking of the vaccines, I have multiple questions here from the people watching on the CBC Saskatchewan YouTube channel. Multiple people asking, Caitlin Schmidt and Swift Squid, both wanting to know about 12-year-olds and younger when it comes to getting vaccines. What do we know about that?
So again, it's not approved yet in that particular age group, and that's just because the studies are ongoing. But I can share with you, Peter, and others that of data that's been released by Pfizer in the age group between 12 to 15 years of age, when that group was studied, there was over 1,000 children that were enrolled in that study, and about half received the vaccine and half didn't. And the efficacy of the vaccine in that age group was 100% in terms of preventing COVID-19 infection. So there were some 18 or 19 infections within the within the study population, and they all occurred within the unvaccinated patient population. The other point that has been made available is that the antibody response was quite robust in children, meaning that their ability to fight the virus or to develop antibodies against that spike protein was very healthy indeed. So in the under 12s, that data is still being generated. Those studies are ongoing. Patients have been enrolled, but we have not yet seen any of the data. So neither I or anybody else can comment on what that data looks like at this point in time.
Great. Well, thank you so much for telling us what you know, Dr. Blondeau. We appreciate that. All right. So far we have only gone virtually to Saskatoon and Regina. So let's go to Swift Current this time, to Speedy Creek. Let's go to Central School, where grade 5 student Noah Enns is here. Hey, Noah, give us a wave.
Hi. My class's question was, what is inside the vaccine and how does it work?
Okay, so Noah, great question. So in Canada, there are two types of vaccines. There's a messenger RNA vaccine, and what's in that vaccine is a message, just as the word says, messenger RNA, and the RNA is like a blueprint, if you will, to tell the cells in the body how to make a protein. And so within the Pfizer and the Moderna vaccines is this messenger RNA blueprint. It's wrapped in a small molecule. Once a person is inoculated with the vaccine or the vaccine is injected into your arm, it then makes its way into muscle cells. The message is then translated by the cell and the protein is produced. So that's one type of vaccine. The other types of vaccines are the AstraZeneca and the Johnson & Johnson. And there they have a slightly different approach, but the end result is the same. So they use a virus vector called adenovirus. And adenovirus is a virus which we see usually during the respiratory season that causes things like the common cold or respiratory tract infections. So what those vaccines do is they take the virus, they make it incapable of replicating in the body, and then they put the message or the blueprint for the spike protein for coronavirus inside of that virus, That virus is then injected with the vaccine. And once again, the virus makes its way into the cell. The message is then released from the virus, translated by the cell, makes the spike protein, and the body sees that as foreign and develops immunity. So two different approaches, but the end result is the same.
Does that answer your
Does
question,
that kind
Noah?
of get at your...
Yes, thank you.
No, I want to ask you,
You're welcome.
how have you been doing with the pandemic? How are you feeling these days?
I've been doing fine, actually. I had COVID in December, and it wasn't as bad as I thought. And it's actually not as bad as I initially thought it would be. But yeah, I've been doing fine.
Well, we're happy to hear that you're healthy. Glad to hear you're doing well.
Absolutely.
Noah, what
Fantastic.
are you most looking forward to doing when we can return back to normal?
Mostly hanging out with friends. I'm looking forward to doing some more sports activities, like playing games and sports that we wouldn't usually be able to do. And yeah, just hanging out with more friends and family and getting to see them again.
Well said, Noah. I'm looking forward to all those things as well. All right. Thank you so much, Noah, and to everybody over at Central School in Swift Current. All right. As we saw earlier, we have a great series of videos from CBC Kids News with host Sarah Chaudry. Let's go to another one. And this one is just perfect following up on Noah's question. This video explores, is the COVID-19 vaccine safe for kids?
Canadians are already getting the COVID-19 vaccine. This has some people asking, is the vaccine even safe? Well, the short answer is yes. Here's what you need to know. First of all, some people could have side effects from the vaccine, like feeling tired, having a headache, and getting chills or a fever. But these are pretty normal side effects for most vaccines, like the flu shot. You may have also heard that some people had allergic reactions to the vaccine. This happened to an incredibly small number of people. If you have severe allergies, the kind of allergies you carry an EpiPen for, you should talk to your doctor before getting the shot. But how did scientists develop the vaccine so quickly? Teamwork. No, really. People around the world were working on the vaccine. Many governments, research teams, and pharmaceutical companies shared information and resources. And thanks to social media, lots of regular people were able to volunteer to be a part of the testing process. The coronavirus vaccine went through the same testing process that every other medical treatment goes through. And since so many people volunteered, there were tens of thousands of people involved. All that information means that scientists are very confident in their results. Do you have a question about COVID-19? Send it to us at cbckidsnews@cbc.ca. For CBC Kids News, I'm Sarah Chaudry.
And thank you very much for that, Sarah. Really informative. And stay tuned. We'll have a few more really great videos like that coming up from CBC Kids News. Now, before we get to our next student, Warda, stand by. We're going to be coming to you shortly. I wanted to ask you, Dr. Blondeau, a question from our CBC Saskatchewan YouTube channel. Now, this is a really interesting one because, often people are thinking about others more than themselves, right? We've seen that so much throughout this pandemic. People like yourself, putting others ahead of yourself. But so this one comes from Sage. And Sage first wants to say thank you to the doctors for their patience. But Sage also asks, my grandparents have gotten their vaccines, but they haven't had their second shot. When do you think people will start to get the second vaccine shot?
So in this province, that has already started. The government has a rollout plan, which once again is based on age. And so right now, I believe the current age category, I think it's moved from 85 to 80. And then there's been a sequential progression from now until the middle of June, before they get to my age group, in regards to what ages then become eligible for their second vaccine. So that has already started. And I think that the government has a very ambitious program in order to see second dosages in as many patients as possible by mid-July. So very, very encouraging news. And so I would remind everybody out there that if you've had your first dose and you are a candidate for your second dose, watch for those announcements and then get in line to get your second dose of immunization.
Excellent. Thanks so much, Dr. Blondeau, and thanks to Sage for that question. I want to ask one more from the CBC Saskatchewan YouTube channel just quickly. This one comes from Serenity, and Dr. Blondeau, as you will well know, it's not just young people who are sometimes afraid of needles. I know plenty of adults who don't like needles, and Serenity wants to know, is there a way to receive a vaccine without a needle?
Not at this point in time. There are other interventions that have been developed in other aspects of medicine that don't use traditional needles. But at this point in time, you actually need the vaccine and the components of the vaccine to be injected into muscle such that the vaccine components are able to get into muscle cells in order to do what it needs to do to offer you protection. So yes, there are a lot of people who are afraid of needles, and men sort of fit in there as well. Grown men, lots of grown men are afraid of needles as well. But at this point in time, it's only by a needle injection.
Great. Thank you, Dr. Blondeau. Okay, students, let's get back to you. You've all been waiting patiently, and we're going to get to every single one of you for your questions. So let's now go to King George Elementary, a great school in Moose Jaw, and grade 6 student Warda Mohammed. Warda, give us a wave.
Hi, I'm wondering what happens if too many anti-vaxxers won't get the COVID vaccine? Will COVID keep mutating and never stop?
So, Peter, I'm sorry, I missed the first part of that question. It wasn't coming through. Can you just tell me what was said?
Yeah, sure. Warda wants to know if anti-vaxxers and the proliferation of that kind of thing will lead to things continuing to get worse. Warda, was that good? Was that summarizes your question well?
Yeah.
Yeah. Okay. Thank you. Yeah. So, we have a concern about, people who have hesitancy in receiving the vaccine. And so long as the number of individuals that are hesitant remains low, then I think the overall herd immunity of the population by those who are not hesitant in getting the vaccine will contribute to the overall immunity of the population. So for me, it would only be a concern if the number of individuals hesitant to get the vaccine was to dramatically increase. And I think at this point in time, it's not at a level where I think we have to have a great concern about it, certainly not in this country and not in this province.
How do you feel about that, Warda? Does that answer your question?
Yeah.
Perfect.
Thank you.
And thank you, Warda, so much for taking the time. We really appreciate it. To you and everybody else at King George Elementary in Moose Jaw. Okay, let's go to the Battlefords. We haven't been into that part of the province yet. And Wyatt Friesen is in grade 6 at Battleford Central School. Wyatt, are you there? Give us a wave.
Our question is, will COVID-19 become a small illness like the flu, or will it completely end?
Great question, Ward. I've been asked this question more times than I can actually remember. And the truth is, we simply do not know. At this point in time, back a year ago, when the pandemic started, I was convinced at that point in time that the virus would run its course and then it would be gone, and we wouldn't have to worry about it. But as the pandemic progressed, I think what we're learning is that it might be that this virus could remain in circulation for the next number of years, and for a couple of reasons. The first reason could be variants, and the second reason could be we're all very fortunate that we live in a country like Canada, and Canada has the resources in order to pay for vaccines for everybody that wants one. But there are a lot of countries in the world that are much poorer than Canada, and they don't have the resources to pay for the vaccine. And as a consequence, it may take a longer period of time for those individuals in the poorer countries in order to get vaccinated. And the longer that takes, then the greater the risk that the virus will stay around for a longer period of time. There's also a risk, of course, that variants could emerge with a large percentage of the population not being vaccinated. So then out of this comes two scenarios. One scenario is that maybe we would have to have a booster shot every year, similar to what we have with flu vaccine. And the second part is that we already know that some of the vaccine manufacturers are working on new vaccines specifically to cover the variants in the event that those are needed. And so at this point, this remains an unanswered question as to whether or not the virus will just fade away or will we require an annual vaccination. I simply don't know the answer 100% to that question. Does that kind of get there for you?
Yes.
Awesome.
Okay.
Wyatt, thank you so much. I'm curious, Wyatt, how has life been in Battleford throughout the pandemic for you?
It's been decent.
Yeah, decent, not too high, not too low.
Uh-huh.
That's good to hear. Are you excited for anything when we can get a little bit more back to normal?
Yeah.
What are you excited for?
Well, I'm able to go to the States again.
Oh, you want to go to the States? Where do you want to travel to in the States?
Arizona.
Arizona, okay. What do you like to do in Arizona?
Go
Escape
to the
winter.
old western towns.
Oh, cool. Awesome. That's awesome.
Fantastic.
Well, Wyatt, thank you so much for taking the time today and asking your question, and send our best to everybody at Battleford Central School. Okay, let's go to Riley Beeds, who is in grade 7 at Canoe Lake Miscou School in Canoe Narrows. Riley, are you there? Give us a wave.
Yeah, I'm here.
Hey, Riley, what's your question for Dr. Blondeau?
Okay. So our grade 7 says, why is it that the coronavirus vaccine was so quick to produce and they still can't find a cure for cancer?
Oh, wow. That is an amazing question. Cancer is a very, very complicated disease, and there are many, many different forms of cancer. And for many forms of cancer, there are treatments and cures that are currently available if they're detected early enough. And then for other types of cancers, there isn't, but maybe someday there will be. With coronavirus and with COVID-19, what ended up happening was that scientists were able to use technology that's been known for the last 20 or 30 years, but they could never figure out a way of making it work in a satisfactory fashion. But COVID-19 forced a number of groups to start working collaboratively, working together rather than in secrecy, and then use their collective knowledge in order to figure out a way of getting this vaccine produced in a relatively short period of time. So I think COVID-19 and the vaccination for COVID-19 could eventually be listed as one of the greatest medical discoveries in the last 100 years. And it'll probably be the basis for how vaccines will be produced going forward. But the short answer to your question, it's because a number of different individuals came together to work on this out of a common interest and goal, and were able to do so very, very quickly. So it's absolutely incredible. And that's a great question. Thank you.
Thank you, Doc.
Excellent. And thank you, Riley, for taking the time today. How are things at Miscou School in Canoe Narrows? How's life been for you guys there?
It's doing great here. We're learning lots and doing much work as we can so I can move on to the next level. Next grade.
Good. That's so good to hear.
Fantastic.
Are you guys excited for summer?
Yes.
Awesome. Riley, thank you so much for that question. And actually, I believe, is this correct? Taryn, are you also at the same school? Yeah, Taryn, let's go to you next. Since we got you, what's your question for Dr. Blondeau?
Unse, yo, oma, Taryn, Miscou School, yo, opasek, unse. How come in 2020 people weren't that sick, but in 2021 people got sick by the minute?
I'm sorry, I missed the first part of that, Peter, because he broke up.
Yeah, Terrence said, so how come there in 2020, it seemed like there weren't many people sick, but in 2021, people got sick by the minute is, I believe, the words Terrence used.
Well, I think what ended up happening, this is a really great question, and it's based on understanding epidemiology. That is the movement of a virus within a population. So in the beginning, when we had our first outbreak of COVID-19, there were relatively fewer people infected, and governments moved in very, very quickly to put in containment measures to keep the virus from spreading. When some of those measures started to get relaxed, we started to see a second wave and a third wave. So one way of thinking about this, if one person is infected, then that one person, based on what we know about this virus, is only likely to infect 3 or 4 more people. But if 100 people are infected, then they're likely to infect 300 or 400 more people. So it really comes down to numbers based on how many people are actually infected and shedding the virus, and then how many people they in turn would transmit the virus to. So that's part of the explanation.
All right.
Yeah, big thanks, Aaron.
And Peter,
go ahead.
Peter, I should also point out as well, because I know these students are going to catch me if I don't come clean on this next point, is that we also know with some of the variants, they're more contagious than the original strain of COVID-19. And as a consequence, people who are exposed to the virus are more likely to get infected. So that's also part of the reason.
Great.
Okay.
Taryn, thank you so much for your question. Thanks to everybody at Mixu School in Canoe Narrows. I want to go back to some questions from our CBC Saskatchewan YouTube channel, which of course you can like and subscribe, and you'll be notified for more great programs like this. But Dr. Blondeau, this one comes from Miss Hopkins' class from Caswell School. Now, Miss Hopkins' class is wondering, what are the long-term effects of COVID? What do we know about that? And are the variants causing any other long-term effects?
So overall, for most people who catch COVID and who survive, they will survive without any long-term consequences. But there are a small percentage of individuals who have been infected and who have survived. And you may hear these people called long haulers, etc. And what has happened to some of these individuals is that they've had some unexplained longer term effects of being infected. Some of them result with slower recovery in terms of, their respiratory function. They seem short of breath, those types of things. And that's probably not unreasonable given that the virus was infecting their lungs. But others seem to have some neurological problems, meaning their brain, spinal cord, etc., where some people are claiming that they have memory loss. They can't seem to find certain types of words when they're looking for them in order to make a point. But the good news about that is that in some of these individuals, when they relearn these words, then of course they have them back. And so what's going to be the consequence of some of these sort of long haulers in terms of their long-term outcomes? We don't know, because we won't know until these patients are followed longer following their recovery from COVID-19. But clearly, there are a number of concerns about catching COVID and being one of these unfortunate individuals that have these longer-term consequences. But every day brings something new with this virus. And every day brings a better understanding of what this virus may have in terms of longer-term consequences in a relatively small percentage of infected people.
Great. Excellent. Thank you so much, Dr. Blondeau, for that. And thank you to Ms. Hopkins' class at Caswell School for watching and submitting that question. Thank you very much. Yom, stand by. I'm going to come to you shortly. But Dr. Blondeau, since we were kind of talking about long-term health effects, I wanted to share another CBC Kids News video that kind of is looking at the flip side of that. So you were talking about the long-term effects. What about people that don't really seem to have any effects at all, people who are asymptomatic? So let's go to Sarah Chaudry again and to talk about what does asymptomatic mean.
There's a word that you may be hearing a lot lately, asymptomatic. What does it mean, and why are people talking about it? Well, let's find out. How do you know when you're sick? Well, you have symptoms. Maybe you're sore or achy, maybe you have a fever or a cough. Symptoms are the effect of germs on your body. But if you have no symptoms, does that mean you're germ-free? Maybe, but it could also mean that you're asymptomatic, meaning that you do have germs in your body, but you don't look or feel sick. Some people who have COVID-19 are asymptomatic. They have the virus in their bodies, but they don't have a cough or fever or any of the other symptoms. So why does this matter? Because even if someone doesn't have symptoms, they could still have the virus in their bodies and spread it to others. That's why it's so important to wear a mask, physically distance, and wash your hands. You should assume all the time that you and everyone around you are infected with COVID-19. Do you have a question you want answered? Send it to us at cbckidsnews@cbc.ca. For CBC Kids News, I'm Sarah Chaudry.
Thanks very much, Sarah. Another great video from CBC Kids News. And Dr. Blondeau, is there anything else that you wanted to add to that, or?
Well, Peter, I think one thing that's important is that we often say from an infection control point of view, the people that you know are infected are not the ones that maybe you need to be the most concerned about. It's the people who you don't know, and then you make an assumption that a person is safe when in fact they may in fact be transmitting the virus. So as was mentioned in the video, if you treat everybody the same and you take these measures to protect yourself by wearing a mask and distancing and hand washing, then you don't assume that somebody's safe and somebody's unsafe, and that's the best protection that you can have. So never assume because somebody's not coughing or sneezing that they don't have the virus.
Yeah, very well said, Dr. Blondeau. Thank you very much for adding that as well. Okay, now I want to go to the Regina Hoodoo School, which I believe grade 6 student Yom Isa is standing by. Yom, I hope I'm pronouncing that right. Are you there?
Yeah, you're pronouncing that right.
Perfect.
So I'd like to thank you for and all healthcare workers for saving so many lives during this scary and deadly pandemic. My class and I were wondering, how did COVID-19 start?
Oh, what a great question. So the current thinking, and there are a number of different theories, so somebody else might give a different answer, but of my review of the literature, it looks like this particular strain of coronavirus originated in bats. And then there's at least one theory that says that it jumped from a bat into an animal intermediate called a pangolin. Now, a pangolin is considered to be a delicacy meat in some cultures around the world. And it's hypothesized, and there's some sequencing data, genetic sequencing data, to suggest that the virus may have moved from the bat to the pangolin. That contaminated meat was in a meat market in Wuhan, China. And then it went from the contaminated meat into a human, and that is where the pandemic started from. And then from one human to another and to another, et cetera. So that is some of the conventional thinking that's going on right now. Of course, there's lots of theories about, other potential origins of the pandemic, but that is the one that I use in my presentations based on my review of the scientific literature.
Yom, how does that answer your question?
Answers it great. Thank you.
Yom, I'm curious too for you. Just what have things been like at the Hoodoo School in Regina?
It's been great. I'm really happy to be at school. I miss my friends a lot, and school's going great.
Is there anything that you are most excited about when we can get a little bit more normal again?
Yeah, I'm really excited to go to a movie theater again because I'm a big movie person. And I'm also really excited to just travel because I really like traveling and I have a uni, so.
Oh, great. Awesome. Well, Yom, I'm a big movie fan as well. So before I let you go, we got to talk movies for a quick second. What's your favorite movie that you've seen recently?
I really liked Forrest. I had a good cry at that. That was a really good movie.
Which one? Sorry, I missed that.
Forrest Gump.
Okay, great. Oh, that's a very good one. Yeah, I've definitely cried during that too, I'm sure. Thank you very much, Yom. I appreciate it. Okay, let's go to St. Joan of Arc in Regina and grade 7 student Ethan Razz. Ethan, are you there? Give us a wave.
Yes, I'm here.
Okay. We're here.
Go ahead, Ethan. What's your question?
How many doses of the vaccine will we have to take before we're okay to go near people? And also, will the poor and homeless get the vaccine?
So for the first part of your question, the current recommendation is 2 doses of the vaccine for those vaccines that are studied in 2 doses. So that's the Moderna, the Pfizer, and the AstraZeneca. The Johnson & Johnson vaccine was studied as a single-dose vaccine. So if you receive Pfizer and Moderna or AstraZeneca, the recommendation is still for 2 doses. Whether that'll change going forward, I don't know. Perhaps it might as new evidence becomes available. But when you have both doses, you have high levels of antibody. And as has been shown in clinical trials, that's where they've tested them in people, they're highly efficacious, meaning that they protect you from serious infection with the virus. So it'll be 2 doses for sure going forward. And I think the second part of your question was poorer countries, was it?
No, it was, will the poor and homeless get the vaccine?
Will the homeless get the vaccine?
Yeah.
Yes.
Yeah, thank you. That's a great question. The vaccine is available to everybody in this province who wishes to get it. So the answer is yes, if they wish to get it, then it's available to them. Yes, and it's available free of charge.
And I also have one more question.
Yeah, go ahead, Ethan.
Sure.
Will it be mandatory for children to get the vaccine?
It is not mandatory. It's highly recommended. But there have been no decisions that I'm aware of that says that you absolutely have to take the vaccine.
Okay, those were my 3 questions.
Awesome.
Good question. Thank you.
Great questions. Ethan, thank you so much. And thanks to everybody at St. Joan of Arc. We really appreciate you guys taking the time today. Dr. Blondeau, so these are... We've gone through all our amazing students that have joined us here on the Zoom, but we do have more YouTube questions as well. And let's get to this one. This is from James L. Alexander School, grade 7 and 8. And their question is, do you have any advice on how to persuade someone who is hesitant of getting a vaccine or for someone spreading misinformation?
Yeah, I mean, I think that, as anybody who knows me knows that I'm an evidence-based person. And as an evidence-based person, I rely on facts and figures in order to guide my thinking and the types of answers that I give. So, Peter, to this point, there's been an interesting survey that's just been released in the United States, where they actually surveyed over 1,000 Americans who have indicated that they're hesitant to get a vaccine. And so they were asked, why are you hesitant to get a vaccine? And the answers that they have given might surprise you. So the first answer was they were concerned about blood clots. That one is a bit understandable because of some of the concerns with the AstraZeneca and the Johnson & Johnson. But the other answers are a little bit more shocking. Some respondents said they were concerned about infertility, meaning that if I get the vaccine, it'll probably ruin my abilities to have children going forward. And of course, that's completely untrue. Some have said it may result in birth defects. Again, there's no evidence for that. That's untrue. And then some have said, well, I'm afraid I'll catch cancer as a result of getting the vaccine. And of course, there's no evidence. So that's untrue as well. But one of the results, which was a bit shocking, was that some people had admitted that they are familiar with some of the side effects, that you might have a sore arm or you might be feeling a little sick afterwards, and they don't want to get that as a result of getting the vaccine. And so the advice that I would give to people, and I think this is a great question, is to make sure that we're always sharing factual information. We know that social media is not the correct place to get up-to-date or accurate information, because people are spreading untruths and misinformation, and some of that is convincing people that there are problems that don't exist. And so I think we have to redouble our efforts to get more factual information out there. I actually see kids as being an important vector for dissemination of information as well. Because if kids step forward and go, hey, I'm not afraid, I've been told that it's safe and I'm going to get vaccinated, I think that shows a certain commitment on behalf of our younger generation in the province that hopefully will influence some of the older folks that, hey, if the children can do it, then I can do it too.
Yeah, is that ever true? And I know that all the kids that are joining us today probably know their science more than I do from my days in elementary and high school. I forget a lot of the stuff I learned, that's for sure. But so thank you to you kids for making sure that we stay focused on science and facts. And if anyone's wondering, I had my first shot of the vaccine, and yeah, I had a little bit of a sore arm. That was it. It wasn't too serious. And I was a little tuckered, a little tired the next day, but it just got me out of doing the dishes that day because my partner was able to do it for me to help me out because I was feeling a little tired, but nothing in terms of side effects. So there you go. That's my personal experience. And I want to get to our final video from CBC Kids News host Sarah Chaudry. But before I do, Dr. Blondeau, one question related to what Sarah's going to tell us about. So, of course, as more people get vaccinated, I think more people think that they don't need to get tested. So tell us a little bit about just the importance of continuing to get tested and when you should get tested, even if you have had a shot of the vaccine.
Yeah, so great question. So if you start to experience any symptoms at all, so you wake up this morning and all of a sudden you've got a runny nose or you've got a cough or whatever, because we do not see any other respiratory viruses circulating this year because of all of the safety measures that we've put in place, there's a good chance that this could be COVID. And so if you're experiencing any new symptoms, then you should get tested. Similarly, if you've been identified as a contact, a close contact or an at-risk contact of somebody who is positive for COVID-19, then you should probably get tested as well. And we do have some recommendations for when you should get tested and how often you should get tested. And we can help anybody who needs to understand those. And as we continue to go forward, even if you're vaccinated, if you start to experience some new symptoms, then that would be an opportunity to get tested as well, because you could be one of these individuals who is vaccinated, not going to be seriously ill, but have a new infection where you could be positive and spreading the virus to other people. And Peter, one more point that's important to make. Despite the fact that the vaccines are highly, highly, highly effective, they're not 100%. So it could mean that we could have a small number of people in the population who have been vaccinated who don't have the same level of protection as, say, their neighbor does. And so even though you had the vaccine, I can't impress enough that if you start to have some symptoms or you think you're not feeling well for whatever reason, then this would be an opportunity to get tested and know for sure.
All right, well, with that in mind, a perfect chance. Let's go back one last time to CBC Kids News host Sarah Chaudry answering the question, what's it like to get a COVID-19 test?
If you think you have COVID-19 or were hanging out around somebody who has it, it's time to get tested. So, what's it like to get a COVID-19 test? The process for getting a test depends on where you live in Canada. Then, the medical staff need to get a sample from the back of your nose or throat. Often, that involves sticking a swab, sort of like a cotton ball on the end of a thin stick, into your nostril. I'm told it doesn't hurt, but it just feels kind of funny. It can take up to a few days to get your results. The thing is, these tests aren't perfect. If you get a positive test, you almost certainly have COVID-19. But if your test comes back negative, there's still a chance that you have the disease. Why? Well, it could be that the infection in your body was too new to show up on the test, or maybe there was a mistake made with your swab. Either way, it's a good reminder to wash your hands often, practice physical distancing, and wear a mask when you can't stay 2 meters apart, even if you test negative for COVID-19. Do you have a question about the coronavirus? Send it to cbckidsnews@cbc.ca. For CBC Kids News, I'm Sarah Chaudry.
Thanks very much, Sarah. I really appreciate that again. And to everybody over at CBC Kids News for helping us out with this today. And Dr. Blondeau, I'm just looking at the questions that we got on the CBC Saskatchewan YouTube channel, where you can like and subscribe and get more notifications from us on things like we're talking about right now. And I'm looking just at a wave of comments and questions, Dr. Blondeau, and a theme is kind of throughout many of them. People are wanting to know, one, is it even possible for everyone to be vaccinated? And, how long will that take before we can, get vaccines to everybody who wants them and to ensure we get herd immunity? I know you've talked a little bit about this, but just any thoughts on that?
So, in the province, the ability for everybody to get vaccinated is very, very high in a relatively short period of time. Certainly by the end of June into July, I think everybody that wants to be vaccinated in this province can have at least their first dose, and many will have their second dose. In Canada as well, there's a very aggressive program in order to get everybody that wants to be vaccinated. And again, the timelines, are in that June, July, certainly over the summer period. That's the same in other developed countries around the world. In poorer countries, it's not the same, simply because of lack of resources. And the timelines that it would take there are going to be substantially longer. And I don't think any of us know exactly how long those are going to be. But I think focusing on Saskatchewan and focusing on Canada, I think that we can see the end in terms of getting everybody vaccinated, at least with one dose, and then subsequently the second dose in a relatively short period of time. And that I think is extremely encouraging.
Thanks, Dr. Blondeau. And another question here from Christine. Now, this is one that I know you won't be able to answer. You're not a fortune teller. You won't be able to predict the future. But the question is, do you think we will still need to wear masks in September in schools? So I guess another way to put it is, for you, what would require us to still be wearing masks in schools in September, and what would how could we not have to do that?
Well, there's some interesting data that's coming out of some very reputable organizations, in particular the Center for Disease Control, or the CDC, in Atlanta, Georgia, which is the main public health guidance institution in the United States. And what they are actually saying is that if you're fully vaccinated, and fully vaccinated means that you have both doses of the vaccine, then you no longer have to wear a mask. You no longer have to adhere to these public health recommendations. We're not 100% sure yet whether or not that's the exact right course to take. And if anything, I think what they're going to do in the U.S. based on these recommendations will serve as a good teaching tool for us in Canada to see what actually happens there. If, in fact, numbers continue to decline in the U.S. in terms of new cases of COVID, then that could be an indication that these decisions were right. If, on the other hand, the number of cases start to increase, it could be a good indicator that perhaps these decisions were too early and the wrong decisions to make at that point in time. I think once we have that information, I think we'd be in a better position to determine whether or not we need to keep wearing masks into the fall. But my guess would be, as the percentage of the population that's immune increases, we will start to see our case numbers go down. And I think we'll start to see some of these restrictions lifted. Whether it's September or whether it's a little bit later, not 100% sure.
Well, Dr. Blondeau, somewhat related to that, obviously one thing that has people concerned about how long this could go on for is a question Miss Schofer, I hope I'm pronouncing that, asks, wants to know about variants. How did they start? Will they keep evolving even more? And will these variants ever end?
So all a variant is it's a mutation in the virus, and these mutations actually occur quite regularly and they're quite frequently. So we know, Peter, that in bacteria, that when you have more than 10 million bacteria in a population, you might go 10 million, well, that's an awful lot of bacteria. Actually, in terms of microbiology, 10 million is not a very large number at all. But once you have 10 million bugs or more, we know that some bacteria will have spontaneous mutations that occur affecting some function within the bacterial cell. Well, similarly for viruses, as a number of viral particles are generated during replication, you have these mistakes in replication that occur. and these are called mutations. And so that's how these arise. And it was expected that when the COVID-19 pandemic started, that variants would show up, and they have. And will they keep showing up? It really depends on our immunization rates going forward, global immunity, and a whole bunch of other variables. But yeah, so long as the virus continues to exist, I think we can continue to expect that we'll see these variants.
Well, and Dr. Blondeau, first, before I ask you one final question from the YouTube channel, I just want to, all our students are logged in right now on the video, even if you've already asked a question previously. If you have any follow-ups for Dr. Blondeau, if you have any one final question you want to ask, just wave your hands in the air like you just don't care, and our producer will let me know that you have another question. So if you have any other follow-ups before we say goodbye today, just wave your arms, and my producer will let me know who has any final questions. And Dr. Blondeau, a final question from YouTube. Braden at JLA School in Saskatoon says, are there any risks with getting two different types of vaccinations? Can you mix them?
Yeah, so we don't know the answer to that question just yet, but there's a large study going on in the United Kingdom, so in Britain, where they're actually studying this very question. And how they set the study up is we've taken a number of individuals and they've given them one vaccine, and then the second dose is with the same vaccine. And then what they did subsequent is they've taken other individuals, they gave them the first dose of one vaccine and then the second dose of the second vaccine, and then they mixed that around, and then the third group they gave the second vaccine first and then the first vaccine second. And we're expecting that there'll be some preliminary data on the outcome of this study available as early as the end of May. At this point in time, nobody knows the answer to that question about mixing and matching of vaccines. But I think there's a feeling that it will work. But until we see that data, the best I can say is we think it'll work, but we really don't have the data to answer the question conclusively.
Great. Thank you very much, Dr. Blondeau, for that. Okay, I don't know if you guys were really excited about asking more questions or if you just wanted to wave your hands in the air like you just don't care. But we do have, I think quite a few people did that, so I'm going to get to the first three that I was told about. So let's go to Rebecca Slavodian again at Regina Catholic's Learning Online School. Rebecca, what's your question?
How prepared has this pandemic made us for a possible next one?
Wow, what a great question. I don't know the right way to answer this question, except to say, when the pandemic broke, we found ourselves in need of additional resources in order to do the testing that was required on patients. And the government came forward and provided us with the money that was necessary to buy the new types of technology that we needed. So going forward, we have this technology now, and we hope that when it gets to the end of its life, that we'll be able to replace it. So from that point of view, we're in a very good position, certainly better than before the pandemic started. But I want to share with you a number. You know what $1 is? You know what $10 is? You know what $100 is, 1,000, etc. When we get up to numbers like $1 million or $1 billion or $1 trillion, a lot of people have a difficult time understanding how much money that actually is. But I think we can all agree that $1 trillion is an awful lot. And there was a study that was published out of the United Kingdom back in November of last year, so 6 months ago, which actually said at that point in time, the COVID pandemic cost the world economy $20 trillion. So that's a mind-blowing amount of money. So arguments have been made to say even if a fraction of that money was spent on preparedness to deal with the next pandemic, it would be money well spent. And so I think what I can say to you is that we're in a much better position right now in the event that we see a new infectious disease arise than we were prior to COVID, but we still have work to do in order to get us as ready as we really should be. I don't mean to sound like a politician with my answer, but we're better than we were, but I still think we have a little ways to go.
Thank you. I think that was a very good answer.
Well, thank you.
I think it was a very good answer too. Thanks, Rebecca, and thanks, Dr. Blondeau. Okay, guys, I don't know when your lunch break is. Is it still 11:45 in schools? That's what it was when I was a kid. But I want to get through our last questions pretty quickly so that we don't want to make you miss the Flintstones. Do kids still watch that? I don't know. I'm aging myself here, but let's go back to Ethan Razz at St. Joan of Arc in Regina, and thanks, Ethan, to your school for tweeting about this. I just saw them tweet a photo of you in the classroom, so thanks for that. And what's your final question, Ethan?
I'm not the one asking the question.
Yeah, we've got Gavin here now. Go ahead, Gavin.
Will this be on news, and will our class be on news?
I'm sorry, Peter, I didn't get that.
I didn't catch that. Sorry, what was that?
Will this be on news, and will our class be on news?
Will this be on the news and your class be on the news? I don't know. That will be up to Peter. Peter
on right
controls
now.
all of this.
Yeah, Gavin, you're on right now. We're live across the province. We're talking to people. That's right.
We have some future reporters here at St. Joan. Thank you.
I love it. Thank you. Hey, please come work for us someday at CBC. We'd love to have you. That's for sure. And we'd love to talk to you again. Thanks so much to Gavin there. Let's go back to Regina Huda School and Yom Isa. Yom, what's your other question?
My question was, how does a space bubble work in a classroom?
Sorry, say that again, Yom. What was it? How does what work?
How does a space bubble work in a classroom?
I'm sorry, I still didn't get how is a space?
Yeah, space bubble. What does that mean, Yom?
Like the social distancing stuff. So like, let's say somebody gets coronavirus, the people around them have to go home. Like, how does that work?
Well, we actually know from other infectious diseases, so infections other than, say, COVID-19, that there are some groups of people that are at an increased risk whenever classrooms come together. We know that from university students. We actually know that from people who enter into the military, that there is at a certain point in time where they're at an increased risk for certain types of infections. So using that as an example, we know that whenever we have people congregate together in a space, like in a classroom, and if somebody was infectious and shedding virus, then the likelihood for transmission of that virus to other people is increased in that environment. However, it's not as simple as that. And the reason being is because we do know that if you're asymptomatic, and you saw that on the video by Sarah, if you don't have symptoms, then you're not as likely to spread the virus as if you have symptoms like you're coughing or you're sneezing or whatever the case may be. When you add that into the other interventions that have been put in place to protect you, like distancing from your classmates, wearing a mask, making sure that you're hand washing and whatnot, it further reduces the likelihood for transmission. So there are two important points in your question. First is that being in a closed environment can increase your risk, but it really depends on how infectious a person is and whether or not you're paying attention to the recommendations to keep yourself safe. And if you do that, the likelihood that you would be infected is substantially reduced, like very much reduced.
Great. Yom, thank you so much for taking the time today. Thank everybody at Regina Huda School for us. Give a shout out to Mr. Rogers, a great person who I believe is at your school there. And before we say goodbye, we have one more question. Let's go back to Lakeview School in Regina and grade 6 student Bria Hutchinson. Bria, what's your final question?
Why can't kids under 11 be vaccinated?
Well, Bria, they might be able to. That study is currently going on where the people who make the vaccines are actually enrolling kids less than 11 years of age into those studies to see whether or not the vaccine is safe and to see whether or not they develop antibodies after they're vaccinated. So as I understand it, the groups are divided into children that are greater than 6 months and less than 2 years, 2 to 5 years of age, and 6 to 11. So there's 3 separate groups that are being investigated simultaneously. And my guess, and it's just a guess, is that the data will show that those younger children can be vaccinated. But we have to wait in order to see the data in order to know 100%.
Great question, Bria. And Bria, before we say goodbye to everybody, let's leave on a final note. You're going to give us one positive thing. What are you most excited about doing when we're all back to more normal lives? What are you most excited about?
Well, I want to travel, like, because we kind of travel a lot and we haven't been able to. So, yeah.
What's your dream place to travel? Where do you want to go?
I don't know, maybe we like to camp more and we haven't been able to last year. So we go places like Clear Lake, Manitoba, we always go, but we couldn't last year because of COVID, so yeah.
Clear Lake is a beautiful place, and I know one of my CBC colleagues will be very happy to hear that. Bria, thank you so much. And that is all our time together today. Thank you to everybody from all the amazing schools in Regina, Saskatoon, Moose Jaw, Swift Current, the Battlefords, Canoe Narrows, and everybody who took the time to join us on cbc.ca/sask, the CBC Gem app, and also, of course, the CBC Saskatchewan YouTube page. Make sure to like and subscribe and ring that bell, and so that you get notifications for future events like this. Let's all get a group wave. Let's all say goodbye to each other. Let's have a great lunch. Let's have a great week, a great weekend, a great spring, a great summer. Stick to the books. Finish the school year strong. You guys have almost made it. It's absolutely fantastic to get to know a little of you. I'm looking out for the kids at St. Joan of Arc to come and take my job pretty soon. They're asking great questions and clearly excited about being on the news. And of course, last but certainly not least, thanks to Dr. Joseph Blondeau for the amazing work you're doing and for always answering all our questions. Thanks very much, Dr. Blondeau. Make sure to...
It's my pleasure.
Awesome. Thanks, Dr. Blondeau. And make sure to follow us on all our social media platforms, Facebook, CBC Saskatchewan Facebook page, on Twitter, Instagram, wherever you like to do your social media. And hopefully we get to chat again. It's so great to connect with people your age. You guys are the future of this province. You provide such an interesting perspective, and we're very lucky to have you again today. So goodbye from me. I'm Peter Mills here at CBC Saskatchewan in Regina. Stay safe, stay healthy, and be good to each other. Take care, everybody.